I'm Elizabeth Lee. I'm certified by the American Board of Plastic Surgery, and in my practice I provide care for rejuvenation of the entire face and body, and it's really great to have these injectable fillers as an adjunct to cosmetic surgery, or as something to do without doing cosmetic surgery for patients who have early signs of aging and are not in any way ready for a facelift or an eyelid procedure or treatment of the nasolabial folds by surgical means. So it's very nice to be able to do this in addition to surgery. So what happens when we age? You can see two pictures here. The one on the left shows some typical signs of aging where you have some loss of facial volume right around the nose and beneath the eyes, so that you start getting this kind of hollowed out look, and you can see these tired bags around the eyes. You also have aging in what we call the nasolabial folds, which is the area that runs between your nose and the corner of your mouth. And you see in the picture on the left that you can get some deep folds in that area. And the picture on the right shows a face. The picture on the right shows a face. Excuse me one second. With shows a face that's had replenishment done, so that you can see that the cheeks look better, the nasolabial folds are more smooth, and the area underneath the eyes are not so tired looking. And so as we use Radiesse to replenish the areas in the face, what we have is a stimulation of your body's own natural collagen, so that you get a more youthful, replenished look after using the Radiesse. Okay, so what is Radiesse? Radiesse is a wrinkle filler that is made up of a calcium hydroxyapatite, and those tiny little calcium spheres will help to not only smooth out the wrinkles directly themselves, but again stimulate your own skin to make more collagen. Loss of collagen is one of the things that happens with aging. And one of the great things about this product is that the results are pretty enduring. And so we can treat a patient and may have results that last for up to a year. And also Radiesse comes in multiple sizes, so we have a choice when we're treating patients to use a different size syringe depending on their actual requirements. So again, we're talking about the fact that Radiesse is a filler that actually stimulates your own natural collagen. And that's a very important point when we're talking about how this filler works. And what you see is an actual patient who has been injected in the area of the nasolabial folds. And it's very clear the difference in the before and after pictures. This is a microscopic view of what happens when the Radiesse is present. So these white spots on the left are the actual calcium particles. And on the right, you have a view 6 months after the Radiesse was injected. And this sample is stained for collagen. And what you can see is all the dark blue represents collagen that has been stimulated by the presence of the Radiesse filler.
Dr. Lee, we actually have a question about collagen, and it is, do other fillers stimulate natural collagen as well?
That's a really good question. None of the other fillers have been studied as well as Radiesse has about collagen stimulation.
Great, thank you.
Okay, so now we have we have some changes, and you can see what you can expect immediately after the collagen, after the Radiesse has been injected. And so you have the patient A on the left, on the top, and you can see her nasolabial folds. And this is immediately after injection. And what's important to see here is not just that you get some immediate correction, but that you can also have some redness. This patient doesn't demonstrate any bruising, and we'll talk more about the immediate effects afterwards, but you can also see that she has some really good contour fill immediately after injection. The patient on the bottom on the left is a patient who pre-injection, and a patient now the same patient post-injection at 12 months. Now, Radiesse has recently released a 0.8 cc syringe, so we are able to have multiple different volumes so that we can give patients exactly what they need. Some patients don't need a full 1.5 cc syringe of fill, and so it's nice to be able to have the 0.8 cc available for those patients who don't need so much. So you can tell as you look through the spectrum from left moving to right that all of these patients have different degrees of aging in this area, and it's easy to see that they would need different volumes to get good correction, with the least volume being needed all the way on the left and the greatest volume being needed on the right. So again, we have the availability of different size syringes, so that we can use exactly what the patient needs and provide the most economical fill possible. And the 1.5 cc syringe of the Radiesse is a larger volume than the other fillers.